Thoracic spinous process. Supraspinous ligament. Costovertebral junction. Trapezius. Paravertebral muscles. Scapular muscles. Lumbar spinous process. Step-off deformity. Paravertebral muscles. Median sacral crest. PSIS. Iliac crests. Glutes. Ischial tuberosity. Greater trochanter. Sciatic nerve.
First, we're going to do active range of motion. So, can I have you bend down and touch your toes? Perfect. So now I'm going to take measuring tape, line it up with C7 and S1, or bend down again. Perfect. So it's supposed to get bigger, or longer I should say, and he's got longer by about 4 inches. Next, we have active range of motion for extension, so I'll move that back. Perfect. We'll do the same thing, C7 to S1, bend back. Perfect. And this one's supposed to get shorter. And so his was shorter by about 4 or 5 inches. Next we have rotation, so we'll use it here. So I'm going to have you look to the left. Perfect. And look to the right. Perfect. So I'm going to line up the stationary arm with his acromion process. And if you look that way. So he is about at 60 degrees. So we're going to do the same thing on the other side. Go ahead and look to the right. This one's about 63. So these are supposed to be about like the same degree, more or less. If they're 1 to 2 off, it's not that big of a deal. If it's just if it is a substantial number, then that's a problem. Next we have lateral bending. You stand up, face the camera. No, sorry, there you go. Have you put your right hand down your leg, stand on the other side. Perfect. Line up with the sacral crest and C7. I'm going to have him bend to the right side. Still lined up with C7, and this one was about 65. And do it again to the left side. That one was 64. So again, pretty close. Doesn't matter if it's like 1 or 2 degrees off, but if it's a big amount off, then that's something you have to worry about. Next, we have passive range of motion. We lay down. I'm gonna bring his legs up, grab underneath his legs and his head, pull together, like so. You should have an end feel of the ribs and ligaments in the back. Next, we have extension, so if you roll over on your belly, hands behind your head, and you're going to lift up, like so. You should have an end feel of the spinous process. Next, we have rotation, so on your stomach or your back. Legs up again. I'm going to hold opposite side, and he's going to bend one way. I'm going to bend the other way, like so. So next we have manual muscle testing. I'm going to hold to stabilize the pelvis, and I'm going to have him push up against my hand on his chest. Very good. That is testing the rectus abdominis and the oblique muscles. So since you're already here, we're going to do rotation. So I'm going to have you go against my hand, or I'm going to stabilize here and have him go against my hand on his shoulder. So perfect. And other side. And then for extension, we're going to have you roll back over. Rotation is testing the obliques, by the way. Alright, and his hands, I'm going to push on his back, stabilize the hip again, and go ahead and push against my hand. Perfect. And now assessing the erector spinae group muscles. Next, we're going to go into the ligament testing, spring testing, or the spring test. So it's checking to see if his the ligaments in between his vertebrae spring back. If they do not move or he has pain with this, then that means that it's a positive test for this test, and that means that he has a sprained facet joint or hypomobility of vertebra. Next is special test. So the salva, you'll have at the end of the table. So I'm going to instruct him to take a deep breath, and he's going to make a fist and blow into his fist. If he has pain with this along the spine, that is a positive test, which means that he has herniated disc that could be putting pressure on a nerve root. Next, we have Milgram's test. So he's going to lay back down, and he's going to hold his feet up off the table for 30 seconds. Go ahead, like so. I'm not going to make him hold it for 30. If he's unable to do this, or if he has pain with this is a positive test, and this indicates that he has a herniated disc and has pressure on a nerve root. Next, we have Hoover sign. So I'm going to hold his legs up in the air. If I ask him to lift one of his legs and he does not put pressure in this hand, that indicates that he's faking it, which means technically this is a positive test. If he just truly cannot do it, that is also a positive test. Granted, you should be able to tell if they're faking it or not. Next, we have straight leg raise. So I'm going to internally rotate his leg and adduct. I'm going to bend up. If he has pain with this, you're going to lower it just a little, and if the pain goes away, and pain comes back when I dorsal flex the foot, this indicates a positive test and means that he has sciatic nerve irritation. Next, we have the well straight leg, so I'm going to do the opposite leg that is injured. I'm going to pull it up. So, if he has pain on the injured side, or the opposite leg that I'm testing, then that means that that's a positive test and indicates he has a herniated disc. Next, we have the bow strings test. So again, I'm going to lift. When he has pain, I'm going to have him bend the knee slightly. If the pain goes away, but yet pain comes back when I push on his popliteal fossa, that is a positive test, which indicates that he has compression or tension on the sciatic nerve. Next, we have the Curring's test. He's going to put his hands behind his head and tuck his chin to his chest and lift one of his legs. Perfect. You can bring it back down. If pain, when he goes up, like so by himself, and then I tell him to bend it just a little, or I bend it, and the pain disappears, that is a positive test, which indicates it has nerve root irritation. Next, we have the stork standing test. So if you can come back here. What he's going to do is put one of his legs up and extend backwards, and I'm just here just to make sure he doesn't fall. Perfect. This is a positive test if he has pain on the weight-bearing side that he is standing on. That indicates that there is a possible interarticularis fracture. And the last test we have is a quadrant test. So I'm going to push down on him as he extends, lateral bends, and rotates. If he has pain radiating down his spine or legs, that means that there's a nerve root impingement. If there's just localized pain, that could be facet joint pathology. And if there's pain over PSIS, that could mean SI dysfunction. Again, this is a positive test if the symptoms are produced when I am pushing down and he's doing these movements. So next we have the dermatoma myotome, so you can lay that down. Again, all these tests are going to be tested by our ability. So with L1 goes from the hip to the groin area. There is no reflex testing for this. Hip flexion is how you test for this. L2 is just a little bit lower. This has hip flexion, patellar reflex. L3 is just a little bit lower. Knee extension, L4 goes to the side of the big toe. That is ankle dorsiflexion. L5 goes to the web of the toe, and that is great toe extension. S1 goes along the side to the pinky toe. That is ankle plantar flexion. And S2 goes down the back to the Achilles, and that is knee flexion. So I'm going to have you come down to the end of the table. So for the reflex testing for the patellar tendon, that is 2, 3, 4, and 5. So just relax. I'm going to hit. And then for S1 and S2, it's Achilles.